where my camera is. Welcome to the breakout section on WISE-MD to enrich your surgery course. And so just a quick introduction for those of us on this. My name is Rishi Reddy. I'm a general thoracic surgeon at the University of Michigan. I've been the clerkship director now for a little over 6 years. I will be talking a little bit about our experience with WISE-MD. We also have Carla Robinson, who is our program director for our surgery clerkship, also at the University of Michigan. And then we also have Dr. Yervadi, who's the chair of surgery at the University of North Texas Health Science Center. And so they told us we'd only have 25 minutes, so I guess we have 35 minutes. So we'll figure out how to go nice and slow. But we have a small group, and so we welcome any questions. I will try to monitor the chat also, but also feel free to take yourself off mute, please. I think we have a small group of about 25, 26 people in on this program. So just to give you a little bit of background, so we've been using WISE-MD at the University of Michigan for at least 10 years, and so it predates my time as a surgery clerkship director. I'll just give you some experience of what we've been doing over the last couple of years. And so we have transitioned our surgery, or all of our core clerkships, which used to be during the third year of med school, during that kind of full 12-month period, to now being during the second year of med school. So really starting in October of the second year of med school and going for 12 months, and then students are taking step one. So over that time period, we also switched from having a 2 4-week clinical experiences. So we used to be a 2-month surgery clerkship with 2 core rotations, now to 3 4-week sessions with, again, 2 core clinical rotations, but then a third 4th-week period of 1 week of anesthesia, 1 week of anatomy, 1 week of pathology, and 1 week of radiology. And so one of the struggles that we have had that I think has been helpful with the WISE-MD platform, and I think that was mentioned earlier by Marianne Hopkins, is that we have a variety of different surgical services, and we try to make sure that our students rotate on at least one what we call core surgery service. But even on that core surgery service, for the minimally invasive surgery service, for example, they may not see the full breadth of everything, though that one may. As a result, we do have an absence of seeing things like breast cancer or thyroid cancer, or even sometimes appendicitis or cholecystitis, depending on what kind of rotations a student may have. And so those have been some of the struggles that we have had. And so having a comprehensive approach has been very helpful, I think, to provide the students with a little bit more breadth. Having said that, we've also been working over the last couple of years to revise our own internal lectures, really to simulate, I think, a little bit of what WISE-MD has done. So as I mentioned, we've struggled to provide the comprehensive experience. We have varied and changed, especially as we've gone through this transition clerkship to now where our clerkship is on that second year period with over 3 months. But we've made roughly 19 to 20 of the modules mandatory, with the remaining being optional. We have included a couple of the skill sets as being also optional for students, but we do have a skills curriculum that's mandatory as part of our clerkship. So having that, I think, as a resource for our students has been helpful. We have not used it for grading purposes. So we have asked students to complete this, and completing this along with some of their other administrative tasks will comprise about 5% of their overall grade, which we call a professionalism grade. We've gone back and forth about tracking the questions that are answered, but because we kind of view this as an opportunity to help them study, we have chosen not to track those, at least for the use of grading. Just internally, one of my thoughts is actually trying to compare the questions and how they've answered to maybe their shelf scores, and we have a lot of data in terms of shelf scores and the subcategory results over the last 5 or 6 years from another project that we've done. And so that's something I'm interested in, but we have not done that, at least going forward. So just in terms of how we approach this, when we were on a shorter clerkship and not on 3 months, I really encourage students to complete these as early as possible, because I think they do take time. They can, I think, speed them up a little bit. But having said that, I've really told students not to save these for the last week. Because I try and get these done in the first 2 or 3 weeks of the clerkship. I think this can help them direct their studying better, as a lot of students nowadays will use question books. They may watch these videos again. They may read. How many of them read, we don't know anymore. But having said that, I think by watching these early, it gives them context in terms of these conditions, and then allows them to direct their studying a little bit more focused, however it works for them. Anecdotally, about 50% of our students really, really love these, and 50% of the students don't like them as much. And that is, I think, obviously people have different learning styles. Again, we have used these to be mandatory, though, I think, to give that breadth. The other thing just I'll comment on, and I'll pass the baton over to Carla, is that we also use these as remediations. And so for example, if a student is on 2 surgery rotations, but they never see appendicitis, or they never see a neck mass or a thyroid nodule, they can use this and use the specific WISE-MD module, and we count that as a clinical experience or a remediation for a clinical experience. And so we just went through the LCME review, and that did pass muster, which is also something we're always concerned about. So that's been our utilization of WISE-MD, at least for the last 8 to 9 years that I've been part of the clerkship leadership. I'll defer to Carla to comment a little bit on some of the logistics here.
Hey everyone, just to give you a little bit of background, I do all the administrative pieces for the WISE-MD module. We do have another clerkship at Michigan that uses it. So our medical school actually pre-registers and registers all of our students for us. So that's one thing I don't need to do. But from what I understand, it's pretty easy to get set up. The other piece is I am able to go in pretty frequently and check to see where students stand on completing these modules. I think you've seen the screenshot earlier on about how easy it is to see their questions, but you can also see if they've completed the modules as well. So it's very similar, very easy to do. I answer questions, any questions students have, and that's mostly logistical, is like, when do we have to do the questions at the end of the modules? We say they're not mandatory, but it's great studying for study. That's our kind of stance on that. And then as Rishi was saying, we really don't track the performance on the questions, but we have gotten some that students really do like the questions, and it helps have them go through the process. And then again, as Rishi said, some don't. So we leave that up to them whether even they want to do the questions, but we do encourage it. I think that's all I have.
Why don't we move on? We'll go to the North Texas Health Science Center experience, and then what we'll do is maybe have a discussion and answer some questions for everybody.
Yeah, thank you, Dr. Reddy. Can everyone hear me? I call from Texas. Great. So basically, this was a lifesaver in the midst of COVID. We already had used the platform and the modules, and then all this hit. So what I did was, I'm a cardiothoracic surgeon, so they do 4 weeks of general, 2 weeks of subspecialty, and recently we're part of a national initiative on a national patient safety certification. So 2 weeks were picked up on that they'll actually be certified with an international safety thing. But anyway, back on my service. So let's say usually I had to revamp this for COVID since I can't get students into the clinical learning environment. So let's say Tuesday is my surgery day. So I'll assign them carotid, maybe an aneurysm case, and then they'll go through that. And then the next day we'll do a Zoom meeting, and I'll go through some of the very, very specific things about when do you remove clamp, what do you do, what's this, to go through to make sure that the students have met. But what we found is that the platform works really well. I tell them as a third-year medical student, I'm not here to train you to be a surgeon. I'm here to train you as a third-year medical student to know how to manage pre and post-op. And then, the icing on the cake is getting to the OR. I have data on COMED. Unfortunately, my coordinator, her sister died suddenly, So I don't have the latest, but I had an uptick, and we're above the national mean now on my surgery shelf COMAT results. Now, is it a matter of because, you know, they have more time now that they're sitting at home, or is it actually the platform? I believe it's the platform and how it's organized. And thank you very much.
So we have 25 more minutes to answer everybody's questions. So we are done. So we have anybody who would like to ask questions, concerns. As I said, you know, we've had a variety of different experiences here in terms of using it.
Question?
Yes.
Yeah, this is Eric Miller from Lynchburg, Virginia, Liberty University. And in our clerkship, I'm fascinated to understand how the remediation part can work. Most of our surgery third-year students are out in community hospitals. And so how can that actually really be used as a remediation type of thing for things they're not necessarily seeing?
So I can just answer, you know, from our institution, you know, as I mentioned, you know, when we have such a kind of a breadth of surgical specialties, even within our Department of Surgery rotations, that, you know, we consider, you know, different patient experiences as kind of core. So things like cholecystitis, appendicitis, managing or treating someone with a breast mass and working them up. So we use those, and because these are kind of case-based interactive sessions, as a remediation for those, if the student doesn't rotate on a service that has access to that. So I think what Marianne had talked about, for example, in her example, and the same thing for us, if the student's on the VA rotation here and they don't see a patient with breast cancer, and then their second rotation is on the general thoracic service on my service, those are two great kind of core general surgery services in a certain sense, where they're going to see a lot of hernias and a lot of other bread and butter, but they may not see everything. And because our VA, you know, doesn't even necessarily see that many like thyroid nodules, so for them to see some of the endocrine stuff, some of the oncologic stuff, that would be how we use that for remediation. So.
Okay, thank you. Appreciate
There's
it.
another way that some schools, so for instance, if your student fails the shelf exam, you can sometimes glean which specific areas they were weak in, and use and assign. What we've done, because it's very hard to make up an entire clerkship, is use a week and assign modules according to the student's weakness.
And in that case, would you then begin to track answers or how they're doing on the actual quiz part of it?
I definitely think, yeah, you can. You can at that point. I think if you're, depending on how you're using it, and that in a remediation sense, I think we've used it in that method before.
Okay, because I think I go along with probably everybody, and that is it's a percentage of our rotation specific grade, but it's a completion grade and not necessarily how they actually do on the questions. So
this is everybody from UNT. I use it myself. I don't, not to grade, but I want to monitor and see kind of what domains, where they are. Is there a weak area, just like you're saying, Eric, you know, then you can drill down on that. And if you build a remediation program for them, what's the whole idea with remediation? Help them fix what they didn't have or they didn't get right. So you can drill down on that with this platform.
thanks, Dr. Yabadi.
Good.
There are a couple of questions on whether they're useful for PA schools, and I think absolutely. They're fairly basic and they're case-based. So, for instance, you know, PAs going into general surgery or most specialties will see abdominal pain and you know, possibly even burns in the emergency room or various things. So some of that fundamental knowledge and speaking to a patient and doing a physical exam is important, as are the skills modules. I mentioned the ultrasound one, but the ultrasound is actually very extensive. It's different components of the FAST exam, but also doing ultrasound in other areas in the emergency room is also really helpful for the PAs. Or all learners, medical students, PAs, DOs, nurse practitioners.
I would agree with that. So we have a number of PAs on our service, and we have a new PA school actually, and so I think the overlap is pretty significant and would be very helpful. So in that setting also.
I have a question. Along these same lines, do you assign the cases to the students based on what you think they will not see?
We've chosen not to do that because of our length of time. We've asked them to do all of them. Obviously, you can assign that depending on what you want. I mean, I think there's a lot of variability in terms of that and how you implement that. So I think it's pretty straightforward to do that if you chose to do that. For us, because of timing and I think my perception of the value of it as a resource, that I think that even it's been a struggle for us to help students in terms of what resources to use, because there's so many different resources now that students use to study and how do they prepare. So they have different question bank books. We have 1 or 2 surgery textbooks, but there's also one with vignettes that we use that I don't think is as high quality. But there's so much variability in terms of what they use. I kind of feel like this is a nice standardized base for them, and that's personally because I like the quality of them, and so I think that this, for us, we use it for the kind of the breadth.
Your students do well on the step 2?
Yeah, our students
Good
have
to
done. Yeah.
Great, thanks very much.
Hi, Dr. Reddy. There's a question from the chat from Dr. Fall. What are the most important lessons learned that you have encountered in your experience that would help educators who are using these modules for the first time this year? The question goes to all of our panelists, obviously.
Sorry, could you repeat that again?
I think what are the most important lessons learned that you've encountered in your time that would help educators who are using these modules for the first time this year? I don't know if any, I can share quickly. I mean, I think that there is a lot of, well, already heard, there's a lot of ways to use the WISE-MD modules. I think you can use it broadly. You can use it more selectively. I think what I would suggest for everyone is really getting familiar with the platform, probably taking a look at all the different lectures and kind of getting a sense of the quality of the questions, and then trying to figure out how that fits into your curriculum. I think that it can be used variably, which I think is one of the nice aspects of it. I mean, we talked about it already being used for remediation. You can use it more selectively. So I think that it can be used to really supplement a variety of different curriculums.
Yeah, this is how you read it. Prior to COVID, I assigned certain modules, but since COVID, I'm trying to recreate this bigger broad-based clinical rotation. So now they're assigned all of them. I think they have more time. They're not scrubbing in. They're not having to go to the hospital, not having them around. I think the students have more time to spend on this. So I'm getting them to do all the modules. And that way, then they get a better broad base. Like Dr. Reddy said, you may not see certain specific types of procedures, and this allows that option.
I think the one thing that students also like about this is that they're very consistent and they have the same feel, and they kind of go through the process the same way. So it provides that consistency in learning that some other resources don't do that. So it gives them a very guided way to start their learning, especially when they're first learning some of this stuff. It gives them kind of a guideline on how to work through a process.
I think that's a great point. I think some of the feedback we've had on our lectures is that our in-house lectures are so variable that sometimes it's a struggle in terms of how to incorporate that and how to address different surgical topics. So there's also another question: is there a formative exam that can be administered at some point? I don't know, Mary. Or sorry.
This is Soba. I can speak to this. My name is Soma Roy. I'm program manager for WISE-MD. Currently, right now, we are not exploring any kind of either formative or summative exam options. We do want to increase our question bank and then also figure out ways to provide more like informative reporting to our users about the question that the students answer. So that's what we're working on right now. But currently, we do not have a plan to create any kind of formative exam using our modules or our questions.
I'll share with everyone just so it's been a couple of years so it may have been 1 or 2 versions ago, but I helped write the questions for the lung cancer module. And so that was actually pretty enlightening. Since then, I've done a lot more question writing within the cardiothoracic world. And so the questions are actually tied in well to the modules themselves. So it's so when we were asked to create those questions, we really have to make sure that we're answering things that are, or we're asking things that are relevant. And so they're not going to be esoteric questions. It's really things that you have to watch the module, you have to pay attention to it, and then the questions are related to that. But then our goal was also to tie those questions into kind of bread and butter topics, that hopefully would be relative to related to the shelf as much as you can hope that it would be. The shelf exam, in terms of how that's been formed, has actually switched, just at least for the surgery shelf in the last couple of years, and is now, the goal is to align that more with the national curriculum within the American College of Surgeons and the Association of Surgical Education. So we're hoping that the questions on the shelf exam are going to be more relevant and even more consistent with maybe what's on some of things like the WISE-MD modules in the future.
Yeah, for those out there, this is everybody, I concur, and Dr. Reddy agree. This is written at a level of a third-year medical student, so it's not like the level of a resident. So I think it's very pertinent that we keep that in mind, that these are written in that way, because like you said, most students will not go into surgery, but the platform is built that way that they should be able to answer. What I also like is the logic progression on the workup and how we think and how we pick up a patient, the history and so forth. As was talked about previously, a lot of this is done as an outpatient arena, and the patient shows up for surgery and the student's missing a lot of in between and front and back pieces. So this fills it in. So I've been very happy with how that platform was built.
So there's another question from the chat. Are there others using multiple online platforms together? We have used WISE-MD for many years, but are adding an additional platform during COVID, just looking for other approaches.
I've added the American College of Surgeons surgery curriculum for medical students as a supplemental.
So I have considered doing that. I've not pulled the trigger on that yet. I've written one of the main modules for that curriculum for the American College of Surgeons. It's just there are so many offerings. I think that is the struggle that we have had, and that I'm trying to protect our students, is that sometimes they look at so many 4 or 5 different options in terms of resources, and sometimes they can get lost in that. So we have not used other platforms, but we make them aware of other things to supplement their knowledge. And we have a core textbook that we also recommend in addition to the WISE-MD modules, but we use that as our bread and butter and kind of the basis.
I also think one of the things that you said earlier, Rishi, is that learners like different methods. Like some students like books, some people like using multimedia. The ACS is very complementary to the WISE-MD modules. I think it doesn't have the rich video and the animations and the interactions with providers, and I think that's really really critical, because we did a focus group in our students, and we found all they love to do is those question books, because they think the shelf is the make or break for everything. And trying to break them of that habit of thinking it's just a shelf exam, where it's really about communication skills, doing a physical exam, that kind of thing. We really felt it's important. We do require modules. I think they can choose which 10 they want, because our clerkship's not that long. But it is tough breaking those habits, but learners like different ways of learning.
So there's another question. What do you hear from students about the most valuable aspects of the case for their learning? How might this be used to win over the 50% of students who don't love them at the outset? So since I commented on that, I mean, we've tried also social media. So we've tried Twitter as a mechanism. And so we've also had that 50-50 divide using Twitter in terms of 50% of the students like are on Twitter already and enjoy it. And the other half are, gosh, don't give me something else to do. I think that the students who have not enjoyed it are usually ones who procrastinate a little bit. And so they're the ones who are waiting until the very end. So there's a variety of different reasons, I think, for that. I think usually by the end, most students have some satisfaction. And Carla, I mean, you can comment on that also from at least our experience. But I do think that there is a significant amount of value, and as we've talked about in terms of the consistency of the program, the consistency between lectures in terms of how to think about things. So, not everyone, is going to love a video format. And so I think that you're going to be hard pressed to make get to 100% satisfaction, but I definitely think there's value for the vast majority.
This is Al from Texas. What my students like is the video component, showing the cartoon with the actual surgical. So, many times in surgery,
I'm on a webinar about WISE-MD.
Sorry.
It's okay. How are you? Okay.
I think somebody needs to mute themselves, whoever's on the phone. Okay.
Sorry, Dr. Yervadi, please.
That's okay. Yeah, my students, what they like is seeing the cartoon with actual surgery, because many times they're maybe second or third down the road. They don't really get to see a really good picture of the carotid as they're doing it, how to unclamp and so forth. So I've gotten a lot of good feedback on that. So they like that component. I got a lot of visual learners,
One of the things, someone mentioned we're updating the platform, and so it's going to be accessible across anything, iPad, cell phone, all that kind of thing. And they can increase it to 1.5 speed. We've even toyed with the idea of two times speed. And a lot of our students actually, when they're on the treadmill or trying to exercise or at night, find they can just put their headphones on and do them, as opposed to having to sit down and fall asleep reading a book.
So looking here, another, how much clerkship directors help students link their basic science learning to the information and decisions in the cases? So that's a great question. We've been mandated in our university as we've done this curriculum change in terms of trying to tie basic science back, or trying to tie what were more basic science into the clinical clerkships. And I actually don't know the answer to that. If anyone else has great ideas on that, we've really struggled in terms of how to do that and to bring the basic science, kind of back into that. So I don't know if Marianne or Dr. Yervadi, what your thoughts are.
Sure. What I do when I do my, my non-surgery day, quote unquote, my fake non-surgery day, that's when I bring in some of the basic science with them as we go through those. That's the time that I use for that with my smaller group.
We actually, the initial design was to bring in a lot of basic science. So you might note in the gallbladder module that lecithin triangle, the bile salts, the triangle, and that we all remember from medical school with little dots. Well, it's actually animated, so it makes more sense. Also, likewise, some of in the thyroid module, the hypercalcemia module, etc., some of those feedback loops from first and second, or first and 1.5, or whatever you have, Rishi, those are also in there. So there is basic science in there, and sometimes it's in the additional information as well. But that was certainly one of the initial goals of the modules, in fact, was to bring in basic science and show how it's relevant.
So I think again, no, sorry. I think that I was just gonna say, I think that again reflects the flexibility. That's all. So sorry, Soma, you were gonna add.
Oh, no, it's okay. I was just going to add to that point. One of the things that we're trying to do, we're going to release a educator curriculum guide where we upgrade our modules, our platform rather. And one of the things that we would love to recommend people to do is, I know a lot of different clerkships or different surgery courses and different kinds of schools will have preceptor groups. So to have the preceptor group, the preceptor kind of reinforce the basic sciences as well within the context of a module would be a really great way to use the modules as well. So.
So I think from Dr. Fall, there's also a comment about don't try this at home moments. I think just to comment on something that Dr. Hopkins mentioned about only, I think, assigning 10 modules because of a shorter clerkship. We definitely had that as an issue, I think, where we had assigned too many modules at one point, especially when we were doing our transition clerkship. And we got a lot of feedback from students that that was a little bit overwhelming. And so we did cut down, actually, this is probably about 4 or 5 years ago. And when we went to our 3-month curriculum, we ramped back up. But where we did really parse it down to a much more bare bones version of that. So I think that is something to be cognizant of, is how long these can take. If a student runs these at normal speed and really engages in the questions, and some people just need that time, and just be cognizant of, if you're at a 4-week clerkship, then you may not, be able to use everything.
That was actually one of our lessons learned too, is the modules were too long, and trying to make them shorter and at least more concise, and there's some redundancy in the beginning of the modules. Like, for instance, you always begin the history with an open-ended question, that kind of thing. So trimming a lot of that excess out.
Can you give just a general idea about how many per week sounds reasonable with your experience?
Yeah, I don't know that. I mean, I think if probably 10 per 4-week experience would probably be pushing it, because if you think about each one taking 45 minutes to an hour, that adds, I think, a fair amount of time, and especially if they're studying with other mechanisms. That's been a little bit of a barometer.
2 to 3 sounds reasonable. They're now almost all should be at 30 minutes throughout the main frame. So it can be sped up, but probably about 2 to 3 sounds. Someone answered 2 to 3, and that sounds reasonable.
Thank you.
So someone else, I think, posted just, we assigned 2 to 3 weekly during our virtual COVID clerkship and tied them in with the weekly lectures in the ACS curriculum and got great feedback. So
one last little point or pearl, which I think Al had mentioned, is, he is thinking of it almost as a flipped classroom. So assigning it before they go to the operating room, if they're going to see seeing the carotid module beforehand really, really helps. And you can also do that with lectures. So if you do have lectures or even Zoom lectures, have them do that, and you can almost use it as a flipped classroom, so that you can just switch to asking students a more in-depth sort of questions, etc., from that area. Take it a little further. It certainly helps before the operating room.
So I think we only have about 3 minutes left, and I mean, we've talked about a variety of different things, but any other burning questions, thoughts? I think we have, again, a variety of different experiences here in terms of how to use WISE-MD. And so just, I think that, key thing for everyone is that it's, the nice thing for our program is that pediatrics has also used it. So from an institutional standpoint, from a purchasing, when there's more than one clerkship, that's been helpful for us. Having said that, our pediatric rotation has not been using it as much, I think, in the last year or two as they have in the past. But we've really, I think, enjoyed it, using that. And it's to be quite honest, I think we've tried to develop more of our lectures and kind of a flipped classroom approach based on kind of the WISE-MD individual videos and lectures, in terms of being case-based and trying to provide a little bit more interaction and allow the students to do a little bit more of the workup, which I think is the nice part or nice aspect of those modules. So it's not that they're watching a lecture for half an hour, it's they're seeing a part of the workup, they have to respond to questions, and so they really do have to engage during that time period. So it is a nice aspect in terms of, I think, active learning. Which is different than some of the other lectures and even some of our homegrown lectures where it's not quite as interactive. So
I want to thank you guys a lot. When I went to medical school, it was either Schwartz or Zabiston. So I appreciate this.
Well, some of our lecturers were still using actual slides when I was clerkship director 20 years ago and started this. Yeah.
I mean, not glass ones.
That they've probably been using, for the last 20 years.
No doubt.
Perfect.